Black Maternal Health Week is here. From April 11th to 17th, join the Black Mamas Matter Alliance and our partners globally for a week of events and activities to build awareness, activism, and community around improving maternal health outcomes for Black women and birthing people. Launched in 2018 by BMMA, Black Maternal Health Week was created to deepen conversations on Black maternal health, amplify community-driven policy, research, and care solutions, and center the voices of Black mamas and families. This year's theme, Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy, celebrates the power of Black-led organizations to lead systemic change and promote community healing. We acknowledge the legacies of injustice while uplifting solutions rooted in unity, advocacy, and transformative care. From in-person events like the 2025 Black Maternal Health Walk and Block Party to virtual conversations and activities, BMHW25 centers Pan-African, Black feminist, and womanist wellness approaches, amplifies community-led solutions, and calls for collective action. So check out what we have in store for you this year. We look forward to seeing you. Follow BMMA across all social media and join the national conversation using hashtag BMHW25. See you there. Well,
good afternoon, everyone, and thank you for attending our webinar titled Thriving in Black Maternal Health Through Policy and Advocacy. My name is Dr. Tony Oberle. I'm a policy analyst consultant with Black Mamas Matter Alliance, and I'll be co-moderating today's webinar with Tamika Jackson, the reproductive justice and Black maternal health organizer from Mothering Justice. And we are so excited to have you here today. We want to thank Mothering Justice for partnering with us on this webinar and their continued dedication to advocacy and bringing awareness to current issues in Black maternal health. Next slide, please. Thank you to our Changemaker sponsors, California Healthcare Foundation. Getting some feedback. Okay. Thank you to our Changemaker sponsors, California Healthcare Foundation and Merck for Mothers, for their support for this Black Maternal Health Week event.
All right. So we're going to do a little bit of grounding. And so before we get started, I would like to cover some logistical items. Everyone is currently muted. Will you stay muted during the call? But to enable closed captioning, click on the closed captioning button near the bottom of your screen. If you don't see it, you should find it by clicking on the More button. And at the end of our presentation, we'll answer a few questions. So please utilize the Q&A box to submit any questions that you may arise. Welcome, everyone. I am so honored to be here in community with each and every one of you that is close to Black Maternal Health Week, and I'm glad that we're here together. But before we begin, I want to take a moment to ground us in the power and the purpose of this space. We are the continuation of a legacy of doulas, midwives, mothers, aunties, freedom fighters who made a way out of no way. We are here because we believe in a future where Black mamas, like myself, birthing people, and babies not only survive, but they thrive. A future where birth is sacred, care is accessible, and our lives are fully valued. As we gather today, I invite us to breathe together. So if everybody could just take a moment and take a breath in and release. Let's root ourselves in the knowledge that our advocacy is a form of healing, as it has been for me, and our truth telling is resistance. We are not here asking for permission. We are here continuing a movement that is bold, brave, and beautifully Black. Thank you for showing up today, for your communities, your ancestors, and for the generations to come. All right, we're going to go ahead and get started.
Okay, we have a great presentation for you all today featuring a panel of state legislators and policy experts as we explore the shifting landscape of state politics under the new administration, with a special focus on Black maternal health. The webinar will address the maternal health crisis and the importance of Black Maternal Health Week and ongoing advocacy, strategies to adjust to changing political environments, particularly regarding racial health disparities, and how advocates and constituents can effectively navigate and influence new policies. So next, I'll share a bit about BMMA. Black Mamas Matter Alliance is a network of Black-led, Black women-led organizations and multidisciplinary professionals whose work is deeply rooted in reproductive justice, birth justice, and the human rights framework to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. BMMA is the premier Black maternal health professional organization focusing on building the skills, convening, and mobilizing the global Black perinatal, maternal, and reproductive health workforce to end maternal mortality. BMMA honors the work and historical contributions of Black women's leadership within their communities and values the need to amplify this work on a national scale. For this reason, BMMA does not have chapters. The Alliance is composed of existing organizations and individuals. BMMA centers on the technical training and developmental needs of the global Black maternal perinatal workforce. And BMMA uses the phrase Black mamas to intentionally include a range of people, cis women, trans folks, and gender nonconforming and expansive individuals with or without the capacity for pregnancy who are of African descent across the diaspora. To those who care for and mother our families and our communities, whether they have given birth or not. And we stand in solidarity with all Black mamas. So here you see that our work falls into four main bucket areas. At BMMA, we approach our work through the goals of working to change policy by utilizing the human rights framework to address health inequities and improve Black maternal health outcomes, to cultivate research that leverages community knowledge and Black scholarship, to advance care by promoting holistic, respectful, and comprehensive maternal and reproductive health approaches to Black mamas care, and to shift culture by dismantling negative narratives on Black motherhood and amplifying the voices and experiences of Black mamas. As efforts to address maternal health inequities in the US continue, we must be more intentional about centering the ingenuity of Black led maternal equity initiatives across the country and globally that are making a difference. This is the primary function of Black Maternal Health Week. One slide back, please. Black Maternal Health Week is held annually on April 11th through 17th, and it's a week-long campaign founded and led by Black Mamas Matter Alliance to build awareness, activism, and community building to amplify the voices, perspectives, and lived experience of Black mamas and birthing people. This week is intentionally held during National Minority Health Month and begins on April 11th annually to join dozens of global organizations in marking this day as International Day for Maternal Health and Rights, an opportunity to advocate for the elimination of maternal mortality globally. The activities and conversations hosted throughout the week intentionally center the values and perspectives of the birth and reproductive justice movements. And the official theme of our 2025 Black Maternal Health Week campaign is Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy. Each year's Black Maternal Health Week theme is carefully chosen by BMMA and our alliance partners to ensure that it sufficiently captures the ethos and spirit behind our collective efforts to amplify the voices, perspectives, and lived experiences of Black women and birthing people. The time is now to demand comprehensive public and private insurance coverage for maternal, sexual, and reproductive health care, improving access to care across geographies and birth settings, issuing guidance to healthcare providers, institutions, insurance companies, and related entities on providing equitable, high quality, patient centered care, and funding research and programs that center and utilize the scholarship of Black women and birthing people. Those interested in becoming involved in Black Maternal Health Week are invited to visit blackmaternalhealthweek.com, with Black spelled BLK, to access information on in-person and virtual events, our Black Maternal Health Week 2025 social media toolkit, and more. So next we'll get into a little bit of data for grounding of why we're here. And we all know the data is clear. Inequities in maternal mortality persist. Notably, the most recent CDC data showed that maternal mortality rates decreased for white, Hispanic, and Asian women, but increased to 50.3 deaths per 100,000 live births for Black women. And this is unacceptable. And what's more alarming are the racial and ethnic disparities, with Black women experiencing the biggest burden. But it's also important to note that 80% of these staggering numbers of maternal deaths are preventable. Many of the states with the most restrictive abortion bans have the worst maternal and child health outcomes and the least supportive social welfare and family support programs, particularly for Black women and birthing people. And we see continued obstacles impacting the advancements of Black maternal health equity in the areas of lack of funding and investments in Black maternal health research endeavors led by Black scholars and community-based entities, a lack of investment in supportive policies that support diversifying the midwifery pipeline and allowing midwives to practice to their fullest scope of training, and reduced and challenging funding and resources for Black-led community-based clinics and social safety organizations. But we know that the state of Black maternal health can feel bleak. But we also know that so many of us are committed to achieving reproductive justice, and that's why we're all here. So next, Tamika will share how Mothering Justice is addressing these challenges.
All right. Welcome again, everyone. I'm so glad that you're here because this work, like Black maternal health, reproductive justice, and economic equity, needs all of us. And I'm so happy that you all showed up. At Mother and Justice, our mission is centered around the lived experiences of Black mamas. We know our stories matter, and we believe in centering those that are most impacted by issues. And because of those stories, they're very powerful and they're very powerful tools for advocacy. So we fight for reproductive justice, economic security, health equity, and we train everyday mamas to become policy leaders through our MamaVis program. Our storytelling strategy isn't just about visibility. It's how we shift narratives and make changes real. I've been able to share my own birthing story and use it as a way to show that we need more comprehensive data collection. So, what does our impact actually look like at Mother and Justice? We mobilize a powerful network of our mamavists, and these are our mothers who are trained to lead and organize our campaigns. Over 100 mothers have shared testimonies that have helped move legislation forward in Michigan. If you've heard of the National Momnibus, we were able to create a Michigan Momnibus, and we've built a strong coalition with partners across healthcare, housing, labor, and justice sectors. And we've amplified our demands through press conferences, digital actions, lobby days that put us face to face with the decision makers. Um, because this is a people powered policy change. So let's talk about our wins. Our Michigan Momnibus is a transformational package for maternal health equity. It has moved through key stages in the Senate and is building a lot of momentum. I actually just got a notification that it has passed the Senate in Michigan. So let's get some for that. And it's gonna be moving over to the House. We're waiting for it to get assigned to a committee, but we're gonna get that legislation pushed through. But let's talk about what we were able to do last year. We helped advance our birth center bill, which passed, didn't just pass through committee, it passed through everything. We are now licensed to have freestanding birth centers here in Michigan. We have expanded Medicaid postpartum coverage to 12 months, which means that people can get the care that they need after giving birth. We actually have a couple programs here in Michigan. One was based in Lansing and moving down to Kalamazoo called RX Kids that actually provides paid stipends for postpartum moms from 0 to 12 months. But let's be real, we're still up against a lot of political barriers, and that's why everybody's voice matters now more than ever. Let's talk about paid sick time. One area that's often overlooked but absolutely urgent is paid sick time. Too many Black women, especially mothers, are forced to choose between their health and a paycheck. And this is for a lot of people. It's hard when you get sick and you don't want to get other people sick, but you got to pay your bills. So we advocate for paid sick time because it's directly affecting like maternal health, infant health outcomes, because most jobs don't give you maternity leave these days. We're relying on earned paid sick time and paid sick time bills to provide us with the time that we need to take care of our babies. So we advocate for it because it directly affects maternal health, infant health, and it really reduces like toxic stress and allows mamas to prioritize healing and family. And this is what we mean when we say economic justice is reproductive justice. So let's talk about our engagement strategy for the legislators here in Michigan. So how we get policymakers to care or to take any type of action and act, it starts with like relationships, not just demands. Like they're people just like we're people. So we engage with them through like powerful storytelling. We do issue-based like scorecards and roundtable discussions. We actually did a whole round around the country last year, from California to Florida to DC. And we use those discussions to keep the focus on the real people and not just the policy. And every event like this one is a chance for us to create like real actionable follow-up and hold our leaders accountable. So at Mothering Justice, we are actually organizing around a lot of our legislation, and we really want more people to help join the movement because your voice matters. And we can't do it alone. And we shouldn't have to. So here's how you can plug in with us at Mothering Justice. You can either follow us on social media, Mothering Justice, on Facebook, Instagram, and sign up for some updates because we have some live legislation moving, especially around maternal health. So if you're in Michigan, we're actually hosting our lobby day for this year. It's called our Mamas March. It's going to be on April 30th. I actually was at our house yesterday on the floor while they came up with our resolution for Michigan so that we would also recognize Black Maternal Health Week. And most importantly, what I have done myself, if you guys follow Mother and Justice, you'll see my story. Share your story. Like our stories are our evidence. Like our stories are real. And some of our stories, they're not included in that data. So this is how we need to grow power. We need to pass policies rooted in our actually lived truth. Because Black mamas, we lead and we all rise when we lead. So thank you all for letting me share and let's keep building this movement together. And our website is motherandjustice.org.
Thank you, Tamika, and thank you for sharing so much of your powerful and inspirational work. It's so exciting to see. Now I have the honor of introducing our esteemed panelists. So, in the order that they're speaking, our panelists are Representative Latasha Mays from Pennsylvania, Representative Dr. Jasmine Clark from Georgia, Senator Sidney Batch from North Carolina, Dr. Sydney Jemmett, Director of Policy and Reproductive Rights at State Innovation Exchange, and Senator Erica Geis from Michigan. Our panelists will have about 10 minutes to share their perspectives of the current state of Black maternal health, identifying challenges and movements, and explore actionable strategies at the state and national levels to improve outcomes for Black mothers and communities of color. We will let all of our panelists speak and will then have time for questions afterwards. So please put your questions in the Q&A box and we'll be monitoring that. So first, we will hear from Representative Latasha Mays.
Happy Black Maternal Health Week. My name is State Representative Latasha D. Mays. I use she, her pronouns. And I have the honor of representing the 24th Legislative District in the Pennsylvania House of Representatives. And I am serving my second term. And it's been a whirlwind. I think many of you know that my background is reproductive justice. And in my previous life, I am founder and was president and CEO of New Voices for Reproductive Justice. So I know the incredible, powerful, transformative work of Black Mamas Matter Alliance and really have been honored to work with Black Mamas Matter Alliance in Pennsylvania and Ohio for many years following the launch of the first Black Maternal Health Week. So I see my role as a legislator to bring the reproductive justice movement to the House of Representatives in our capital in Harrisburg, Pennsylvania. I'm originally from Philadelphia, but I've spent 26 years here in the city of Pittsburgh, and those experiences have really formed and shaped my approach to reproductive justice-based legislation, intersectional policy, and how all things must be approached from a reproductive justice lens. I was able to work with state legislators, and let me back it up. I've been able to work with badass Black women legislators for over 15 years in Pennsylvania and Ohio. I get to work with some of them today in the legislature. And before I became a state rep, I was doing Black maternal health work with state legislators. And so in 2019, when I sat in the room in Columbus, Ohio, with the Black women legislators who created the Ohio Black Maternal Health Caucus, I immediately called my now co-chair of our caucus in Pennsylvania and said, we need to create a Pennsylvania Black Maternal Health Caucus. But she was saying to me, you know what? It is not the time, because elections matter. And I know this is a C3 call, but we have to hold majorities in order to move the bills that we know will make a difference in the lives of Black mamas and birthing people. So my colleague told me we weren't going to be able to do it in 2019. I continued to do the work around Black maternal health through New Voices and other opportunities. And then when I ran in 2022, that was core to my vision for what I wanted to do. I did want to expand spread my wings and expand my horizons, as they say. But when I won in 2022 and started this journey as a legislator in 2023, I met one of my sister reps, Rep Gina H. Curry, who had also just been elected to the House. She's like, I want to do something for Black Maternal Health Week. And I know you did that reproductive justice thing. And I was like, girl, I'm trying to do something else. And so we were able, but she convinced me, and I understood how important it was at that time in 2023 for us at the state level to uplift Black maternal health and Black Maternal Health Week. And so we started that journey together along with Rep Morgan Cephas, who had been the one that said, I don't know that we can do this in 2019. But after we all were in the House of Representatives, I called my other sister rep and said, Rep Cephas, we need to create the Pennsylvania Black Maternal Health Caucus. And so we did in October 2023. So it's only been about 18 months. So we come into the space from different places and different backgrounds. I'm a new mom. So I'm a Black woman, I'm a Black woman legislator, and I'm a Black mama as well. Rep Curry is a mother of 3, and Rep Cephas is a sister of 4, and also has her niece and shares experiences around maternal health challenges. But it took all 3 of us to be there to address the public health crisis of Black maternal mortality and morbidity in the Commonwealth of Pennsylvania. And so as I speak to you today on this last day of Black Maternal Health Week, 93.5% of maternal deaths in Pennsylvania are preventable. And Black mamas and birthing folks are 2 times more likely across the state to die before, during, and after childbirth compared to their white counterparts. But we know those numbers change as we go from city to city or region to region. So we can't always just look at the statewide numbers, because Philadelphia County is contributing to 75% of the maternal deaths. And so we also know that in Allegheny County, where Pittsburgh is located, the outcomes for maternal health around maternal mortality and morbidity, Pittsburgh is worse than 97% of similarly situated cities. So we are coming together from different parts of the state, recognizing the grave challenge we face around healthcare access, maternal healthcare access, and reproductive justice in our Commonwealth. So with our powers combined, we, over the last 18 months, have performed miracles by putting Black maternal health at the center of our priorities, and not only the House of Representatives, but in the full Pennsylvania General Assembly. So we launched our caucus October 2023. We were able to pass some bills that we had been moving before we launched our caucus into law, including measuring Black maternal morbidity. That wasn't happening before we arrived into the House together. So in the spring of 2024, so just last year, just a year ago, we introduced our first Pennsylvania Momnibus. We introduced 8 great bills, as Rep Curry calls them, that were research and evidence-based practices to improve maternal health outcomes. And so, we were met with a lot of resistance, but we were also met with great confidence, joy, and support from the first Black woman speaker of the House of Representatives in Pennsylvania, Joanna McClinton, who I had worked with before prior to coming to the legislature. She and our caucus leadership made Black maternal health a priority. And our health committee chair based here in Allegheny County, Rep. Dan Frankel, had been one of the most vocal advocates for women's health because there weren't as many women when he first started out in office, but now there's so many more of us. But he has been a vocal champion for women's health, reproductive health, rights and justice, and Black maternal health. So we were able to move 5 of our bills that included things like blood pressure monitors, implicit bias, maternal and newborn child supply kit program pilot, um, maternal mental health education. We were able to move 5 of our 8 bills out of the House from March of 2024 to October of 2024. Now, I know I have my fellow sister legislators on this call. You don't move bills that fast when they're talking about Black people, when those bills are talking about Black women and the gender expansive folks, or when it's talking about Black maternal health. So it is a miracle that there is a Pennsylvania Black Maternal Health Caucus. There's a miracle that we were able to get those bills passed, 2 of which became law in our first 6 months after we introduced our omnibus. And we celebrated our 1-year anniversary in October. But we have dealt with every facet, so many facets, I won't say every, so many facets of the issue, from maternal health deserts to increasing the perinatal workforce and supporting the Pennsylvania Doula Commission so they could help doulas who want to be in line to be reimbursed understand that process. We have challenged our managed care organizations around how they compensate birth workers. And we have taken our Republican colleagues to task around the rural maternal health deserts that they have, but you can't support our bills that are for all moms and birthing people because we say Black. We have had to do all of those things to bring significant momentum to the work of this public health crisis. And so, at the start of a new session, we come in with reinvigorated by what we've been able to accomplish and bringing Black mamas and birthing folks and Black maternal health organizations and stakeholders to our Capitol to put legislators on notice. If you're not with Black maternal health and the Black Maternal Health Caucus, you're on the wrong side of history. But we've been able to move the needle, as Rep. Cephas says, on Black maternal health in our Commonwealth. And we are just getting started. One of our biggest victories from last year, too, was the greatest investment in maternal health and Black maternal health in the Pennsylvania state budget. Previously, maybe we had 10 or 12 million for maternal health, no money for Black maternal health specifically. Last year, we were able to, we were all the co-chairs were members of the Appropriations Committee, which is as we know, is the Money Committee. And we need everybody listening to understand the committees that control the destiny of Black mamas in the legislature. So we were able to secure $23 million for maternal health and Black maternal health in our state budget for the first time ever. And that's the power of what we can do with our caucuses, the power of bringing people together, the power of lifting up the stakeholders who work with us, the power of a Republican rep whose daughter had a baby out here in Western PA, and her daughter had to drive 45 minutes to Ohio to have her child. But we have been relentless, and we have been unapologetic about talking about Black mamas. Because when we fix Black maternal health, when we eradicate Black maternal mortality and morbidity, we do it for all moms and all birthing folks, as Rep. Curry says. And so now we just are off the heels of our first statewide Pennsylvania Black Maternal Health Week Summit. It literally ended yesterday. And we brought together legislators from across the state, Western Pennsylvania elected officials, our lieutenant governor and our second lady, who are a young Black couple from here in Pittsburgh. We had former Steelers players. We had dads talking about maternal health and their role to play, their powerful role to play. We also had our city and county leaders, Mayor Ed Gainey and County Executive Sarah Namarato, our Speaker of the House, of course, and all the incredible people who came together to put Black maternal health on the map in Western Pennsylvania and across the Commonwealth. And we introduced our Momnibus 2.0. And as I come to a close, I just want to share what we introduced just 2 days ago, and how excited we are to ensure that we get people on the bus, that we get them engaged in this powerful movement for Black maternal health. And some of the things that we introduced were, we reintroduced my blood pressure monitors bill for Medicaid coverage. My colleague here in Pittsburgh introduced that coverage for private insurance. We also, from here in Allegheny County, have my brother rep introduced the Pennsylvania Dads Matter Act. Rep Curry and I reintroduced the maternal and newborn supply kit pilot program. Rep Curry has introduced bills on addressing maternal health deserts and midwifery practice innovation. I've been able to introduce a bill to ensure that there are nursing and lactation rooms in every state building in Pennsylvania, and making sure that pumping is included in our Breastfeeding Act, and that we're going to support a moms and substance abuse diversion court with our other allied rep, Rep Chris Pielli. So those are some of the things we hope to do this year. And with the support of fierce and fearless Black maternal health advocates, we will get it done. We are deeply committed to addressing this statistic that 93.5% of our maternal deaths are preventable. And our question continues to be, why are we not preventing them? I'll close with things that anyone listening can do or help to do. The Pennsylvania Black Maternal Health Caucus is one of few caucuses in the nation. If you are in a state without a caucus like ours, form or help to form a Black Maternal Health Caucus. And we recognize that the politics or the state of play is different everywhere, but there is a need, there is a desire to create these caucuses, and they do work. Help or introduce a Momnibus. We know we are borrowing from the federal work. This has been an incredible vehicle to engage those who want to support. Host a robust Black Maternal Health Week. That's low-hanging fruit, and there's so many ways to do it. Then also, just my last two items are organize Black mamas. I'm an organizer, and I bring that to the legislating that I do. Without organizing, we will not win. We will not be victorious, even in our political, electoral, or policy endeavors. And lastly, meet the material needs of Black mamas in any ways that we can. We have to do bread and justice. We must always make sure that our Black mamas have what they need to be in this fight with us, to fight for our own lives, for the lives of our children. And I thank you so much for having me today on this last day of Black Maternal Health Week.
Wow. Thank you so much, Representative Mays. Thank you for all of the work that you're doing and continue to do. And congratulations to all of the successes as well. We appreciate it and we need it, and we see you and value you. Next, we will hear from Representative Dr. Jasmine Clark.
All right. Hi, everyone. And thank you all so much for being a part of this. This is amazing to see so many people interested in such a timely and important topic. So I am a state representative here in the state of Georgia, and Georgia has a long way to go. I'll just start there. Georgia is one of the worst states in the country to be pregnant and have a baby. We have one of the worst maternal mortality rates in the country. There's only maybe 2 or 3, depending on which list you use, states that have a worse maternal mortality rate than the state of Georgia. And in Georgia, Black women are, as we have already mentioned, disproportionately impacted by maternal mortality. And also what has been mentioned is this these deaths, these pregnancy related or pregnancy caused deaths, are many times, a majority of the time, preventable deaths. I think in order to understand some of the underlying themes or some of the underlying issues that contribute to why this is so abysmal in our state. We made national news, unfortunately, when it became clear that our abortion ban, which ties your ability to seek an abortion to whether or not there is fetal heart activity, our abortion ban has actually led to deaths. Amber Nicole Thurman and Candy Miller, unfortunately and tragically, are no longer with us today because we have laws in place that made hospitals second guess whether or not to provide care. So what you have is hospital administrators and lawyers and people who are not necessarily medical professionals trying to decide if a person is dying enough in order to save, or trying to decide whether or not they can save someone that they are unsure whether or not they have tried to induce an abortion, maybe using the medication abortion process. The effect, however, is that there is a distrust, as well as, again, lives are lost in this process. We also recently had a case in the state of Georgia where a woman, 24 years old, Selena Maria Chandler Scott, had a miscarriage, and she disposed of the remains in the dumpster outside of her home, and in that process she passed out and bled out. And instead of her getting care, they arrested her. They put her in jail because these draconian abortion ban laws, they have the impact of, number one, delaying or completely preventing people from getting the care they need, but also it criminalizes things like miscarriage. And so what a lot of people don't understand, they don't connect the dots, they think these laws happen in silos, is that when you try to ban one thing, there is collateral damage that happens in this process. And so the criminalization of abortion leads to the criminalization of miscarriage and the criminalization of maternal health care in general. Where is the line? And so this is why it is so important that we're doing things like this, and that we're speaking up, and that we are having these opportunities to talk through these things. So, some of the other things that I think are important to bring up before I kind of start talking about, the light at the end of the tunnel, is that in the state of Georgia, we have been talking a lot about mental health. And I'm not sure if it's the same way where you all live, but I feel like in our state legislature, we get buzzwords. And one of the buzzwords that has been going around is like mental health. And it doesn't matter what side of the aisle you're on, everyone's like, I'm a champion for mental health. But then the moment you acknowledge that one of the top 3 contributors of maternal mortality is mental health, then people are like, yeah, not that mental health. Like, I'm a champion for, fighting mental health in a lot of different ways, but I don't necessarily want to touch the mental health of, women and birthing people, mamas and birthing. I don't want to do that. And so we run into this situation where people try to put blinders on and say they care about people's mental health until it's time to acknowledge that the mental health of mamas and Black mamas, future mamas, current mamas, all of these things are really important right now in the moment. And you can't pick and choose when you care about mental health and when you do not. Also, it's very interesting. Georgia's a geographically large state. We have 159 counties. Of those 159 counties, over 50% of them, knocking on 60% of them, are what we refer to as maternal healthcare deserts. Honestly, a lot of them are healthcare deserts generally. But maternal healthcare deserts specifically, there is no OBGYNs in these counties. And a lot of times there are hospitals that have everything except for a maternity ward. And they will tell you, you can come here with a broken toe or a gunshot wound, but do not come here with a baby because we can't do anything with you. And so people have to travel quite far in order to deliver a baby. But not just that, what if there are complications and time and things that are time sensitive? The ability to get to the hospital in a timely manner is very important and a contributor of maternal mortality. And the last thing I'll talk about is the fact that Georgia is still one of the few states that has not expanded Medicaid. And because of that, we have hundreds of thousands of Georgians, including hundreds of thousands of women and birthing people who do not or who would not otherwise have access to healthcare until they are pregnant. So the state of Georgia will provide you with Medicaid, pregnancy Medicaid, if you are pregnant and for 1 year after, and we had to fight for that 1 year, so that is a win. However, outside of that window, they don't have access to care. So the only time they've actually regularly see a doctor is when they are pregnant. And that contributes to maternal mortality because cardiovascular disease is, again, one of the top 3 reasons for maternal mortality, and unchecked cardiovascular disease can exacerbate or make it more likely for maternal mortality to occur, maternal death to occur. So one last thing, and I'm going to rush to what we can do. I'm a researcher. I'm in science. I think everyone out here is seeing what's happening at the federal level and is trickling down to the state level when it comes to the attacks on DEI and how that impacts Black women. Because there needs to be, it is vital that there is research specifically on why are Black women dying more than anyone else. But now it is illegal to even use those types of words in your research proposals. So what we have done in the state of Georgia, we have done several resolutions, such as the Reproductive Freedom for All and a Reproductive Freedom Act, Reproductive Freedom for All and Reproductive Freedom Act resolutions and bills. They have been introduced, but unfortunately they have not passed yet. We also have bills out there that would create a maternal health momnibus, Black maternal health statistics, tracking of Black maternal health statistics, and creating a Black maternal health caucus, similar to what some of the other people on the call have talked about today. And we did pass a bill that said that psychiatrists or psychiatry records can also be considered by our maternal mortality review committee, which I think is good and an important step in recognizing the link between mental health and maternal health. And so if I were to give some special action items as I close today, what I would say is, if you're in Georgia, help us by helping our colleagues to recognize the importance of this issue. I can provide bill numbers if that's necessary for you to ask for these bills to get a hearing. It's interesting, we can pass privilege resolutions very easily. You don't have to do anything, but a resolution that acknowledges Black maternal health or Black people in general somehow gets stopped and needs an actual vote. So I would ask that we would ask for votes on those bills. The second thing I would say is, if you are in medicine or you do treat patients, and I didn't even get to like the doulas and the midwives and things like that, support the efforts to get Medicaid reimbursement for doulas, but also just have insurance acknowledge doulas as a part of the care team. And if you are in medicine, I had a meeting with doctors earlier. If you are in medicine, try to create a spirit of collaboration instead of a spirit of adversity when it comes to doulas. So this is something that came up. Doulas are there to be a part of the process. They are not serving in an adversarial role to the healthcare providers. But oftentimes there is this butting of heads. And so intentional collaboration and intentional understanding between those two groups, I think, is something that we must do in order to improve health outcomes and improve the process for everyone. And then in the state of Georgia, we're working on midwifery licensing so that people have more birth options. I think that is really, really, really important that people have birth options. In the state of Georgia, technically, home births are not technically legal because there are no midwives that are licensed to do that. So we do need the licensing, but we also have to make sure that in the process of licensing that we get it right. And so if you are in that space, being able to provide the information to make sure that we get this process right so that we're not leaving out midwives that should be providing care, and also that we are making sure that midwives are able to provide the best care possible. That is something that would be great for people who are here. So call us, collaboration, and working with us to, have good policy that works for everyone and improves health outcomes. That would be my 3 action items. And I thank you all so much for the time, and, work on us in Georgia. We're working, we're trying, I promise.
Yes, thank you so much, Dr. Clark. We really appreciate you highlighting fighting criminalization and also those really tangible action steps that we can take to make change. So thank you so much. Next, we're going to hear from Senator Sydney Batch from North Carolina.
Hi, great to see all of you, and thank you all for joining. I am Sydney Batch, and I am the Senate Democratic leader in the North Carolina Senate. I would say that Representative Clark and I are in the exact same boat in which we wish we had nice things like some of our blue states, but we are sitting here in the breach and fighting for what is right. And even in some of those obviously blue areas, we also know that we oftentimes as Black women get lost and are not advocated at the same levels as some of the white women, and frankly, just maternal health in general, especially with this federal administration that we have. And so here in North Carolina, the landscape basically is that we have, for the last 3 to 4 sessions, filed our own Momnibus Act and other several bills that we've had that actually focus on maternal health. And my entire idea and notion is that given the fact that we have so many Black women who die and Black babies in North Carolina, we have abysmal rates just like Georgia and many other places in this country. We are really trying to advocate as loudly as possible to all of our colleagues in the legislature regarding what our values are. And oftentimes we get ignored. We are not in the majority, therefore our bills can't move out of committee without a whole lot of pressure and asking of Republicans here. And they have said no at every single turn. We've given the opportunities once again to go ahead and vote for our bills, but they go nowhere. And so some of the bills that we've actually advocated for and had an amazing press conference just here, yesterday actually at the legislature, was about our Momnibus bill, which of course dealt with doulas as well, as has already been mentioned. And I will not bore you all because there's so many of us that want to reach out to you about some of the other bills, but we've done paid family leave for years on end. We have also ensured that we filed a Safe Pregnancy Act. In North Carolina, there are no protections for pregnant women. And so if you are working at a grocery store or you are standing on your feet all day, we have asked for simple accommodations such as sitting on a stool or having a bottle of water. That has actually been denied. So the lowest hanging fruit about a state that claims to care about children and care about women, as we have restricted abortion access here as well, is also a state that only cares about what I would say is they are pro-birth. They are not pro-mother. They are not pro-child. They want you to be forced to have a child, but they want to do nothing in order to ensure that we have the safeties, the protections, and also, frankly, good paying jobs and access to healthcare that is absolutely necessary after we give birth. And our lives are just not valued the same. And so we had an amazing press conference yesterday with a lot of women and partners that we work with who came and actually talked about their really tragic, sometimes tragic experiences and also tragic births. One woman who, of course, many of you guys know, also are disproportionately affected by stillbirths. And we don't talk about that enough as well. We don't talk about the bereavement and the grief and all of the supports that we need in place in order to help mothers after they have the tragic loss of a child. So we've been elevating that message here in North Carolina, but the reality is it falls on deaf ears. What we do, at least in the Senate, is that we have made it very clear that we are going to ensure that we are going to get our Republican colleagues on those votes. So we run our bills, which we can't get out of committee, as amendments. And we have our Republican colleagues voting time and time again against paid leave, against the Safe Pregnancy Act, against our Omnibus bill, against simple measures that would not only improve the lives of Black women, but all women, because we know a rising tide lifts all boats. And frankly, if you improve outcomes for Black women, white women are naturally going to benefit. That is just the way that the world works. And we know that that's how medicine works. We also have a deluge of a lot of legislation getting rid of DEI here in North Carolina and saying that we should just not see color and it doesn't matter, et cetera. But the reality is that myself with 3 degrees from the University of North Carolina at Chapel Hill is more likely to die or have adverse outcomes of giving birth than an 18-year-old high school graduate who's white. That's just the reality. And so you can't say that it's not because I didn't have access to healthcare. You can't say it's not because I didn't eat well, that I am not educated. The reality is there's something broken within our systems, within the racism that happens and the way in which we are ignored and called malingerers because we actually complain about something that's going on, to then say that our lives are clearly not as valued, because it has nothing to do with education. Those disparities are baked in a institutional racism and a medical system that does not value our opinions and does not value our lives. And so it is on us, and I believe incumbent on us, when we are in a situation, in a position of power, that comes with great responsibility. And so even if we can't move some of our legislation, it doesn't mean that we don't talk about it, that we don't use our bully pulpit, and that we don't stand in the breach to let everybody know what we care for. And we hold our Republican colleagues accountable because they have the purse strings and they have the power. Many of the bills that we've actually proposed don't even cost any money. They just won't do it. And so when election time comes, we go ahead and remind them of all of the things that they say they value and then prove otherwise with their voting records. As it comes to legislation and how we how you guys can advocate for change, what I would say is that if you are in a state similar to mine, a lot of the Republicans are not moved by statistics. They don't know what evidence-based research is. They're not interested in our numbers. You have to put a specific face and a story behind what we are saying. You can infuse all of that information and all of that knowledge when you are talking to them. But the reality of the situation is when you see a TV commercial, people don't give to ASPCA just because they feel like it. There's a sad dog and you have, the eyes of the angel singing in the background and people give. You don't give because you see, oh yes, kids need to eat. You give because they say, oh, you can go ahead and save 5 starving children in a different country if you just give $5 a day. We are motivated, for better or for worse, by emotion. And what I would say when you guys are advocating is to not only find a legislator who you can actually go ahead and try and build a bridge with, because I believe that it's really hard to actually hate up close. You might have to bite your tongue in some of these meetings. But if we want to have nicer things, and if we want to save Black women, if we want to save babies, we have to go ahead and meet power where power is. And sometimes that means that we may not be the best messenger. And you just sort of need to know that going into it. What I do is I try and find constituents who could vote for that legislator, who also happens to be in a position of power, to meet with, to tell their story, to build a relationship and connections with, so that you can eventually get them on your side and to get them to try and at least consider a different frame. And sometimes that means removing some of the things that you would otherwise want, just so that you can go ahead and at least get your foot in the door. What I would also just be remiss in not reminding everybody on this call is that As a breast cancer survivor, I would tell you all that disproportionately Black women also have dense breast, and that mammograms with dense breast do not always pick up. They miss 40% of cancers. And so for the opportunity that I always have to speak to women and 230 strong, powerful women and some men who are on this, I would tell you, if you love the women in your lives, make sure that you get a mammogram. But more importantly, if you have dense breasts, ask for an MRI or ask for an ultrasound, because it will likely catch your cancer at a much earlier stage and save your life. We disproportionately have dense breasts as Black women. And it is extremely important while we talk about maternal health that we are also talking about what's actually occurring within our own bodies, and to ensure that we are taking care of ourselves. And that goes the entire gamut from birth until death. We know that we care about mothers at all stages of their life. And just because you have a healthy birth and just because you have your baby does not mean that your value goes down at all. And we need to advocate for all levels of our care and for our value in our society. And it's always hard, and we are not oftentimes heard, but it is our responsibility to make sure that we share that message everywhere. In closing, what I would also just ask you guys to do is to realize that there, in places where it's really blue and you guys don't have the ability, or you don't have to actually work as hard to get legislation passed, there are a lot of people on this call, including Rep. Clark and I, that would love for you to, of course, lend your support, your energy, and your time into our states, where we are building and trying as much as possible to build to a majority and relevancy with regards to a lot of this legislation, and having your voices and having your time and your sweat equity being borrowed to our states would be a huge, huge boon. So I thank you guys for everything that you're doing. I share in the fact that I have 2 boys who are healthy, but I had 2 cesareans in large part because of issues that also occurred within my own pregnancy. And so I speak to this from a personal standpoint as a mother of an OBGYN. Oh, this is government working. Hold on. Sorry, I'm in my legislative office and the lights just went off. We care about saving energy, not just saving mothers' lives, sadly. But with that, as a child of an OBGYN and a person who has benefited from her actually helping save my son's life while we were in the OR, not all of us are going to have OBGYN Black moms that are there to advocate for us. And that should not be the system that we, of course, are bringing our children into. So thank you so very much. Really appreciate being here, and I appreciate all of the work that you guys are doing in order to save more women's lives and to, of course, elevate this issue.
Amazing. Thank you so much, Senator Batch, and thank you for sharing your personal stories and reminding us of the power of uplifting emotion and connection in our advocacy. So thank you so much. Next, we will hear from Dr. Sydney Jemmett from State Innovation Exchange.
Hello, everyone. I'm Sydney. My pronouns are she, her, and I am the Director of Policy for Reproductive Rights at State Innovation Exchange. I want to thank Black Mamas Matter Alliance for this invitation to speak today, and thank you all for making time for this. And it's such a special topic for me as a Black mother, and I'm really excited to be here. Next slide, please. Okay, so it has never, ever been more clear that state legislatures are among the most important battlegrounds for progressive change. Next slide, please. So State Innovation Exchange is a national resource and strategy center that collaborates with state legislators to improve people's lives through transformative public policy. SIX works in close coordination with legislators, advocacy groups, think tanks, and activists to provide the tools and information legislators need to be successful. I'm presenting as a C3, but we also have SIX Action, which is our C4. And SIX does its work through 2 staffing strategies. We have state directors who are based on the ground in 7 states that you can see on the map. And they work deeply in community and in their state houses to support lawmakers on all of SIX's issues: democracy, economic justice, agriculture and farming, and reproductive rights. SIX also has program experts, which are leaders in our issue areas who provide deeper subject area support in all 50 states. Next slide, please. And I am on one of those program teams. This is our current SIX reproductive rights team. We are committed to working on access to abortion care, but also firmly believe that contraceptive access, birth justice, Black maternal health, paid family leave, and other issues fall under the reproductive justice framework. That's the values framework our team seeks to work under, even though we are technically a reproductive rights organization. Next slide, please. SIX is committed to building progressive power at the state level by providing lasting and personalized support for state legislators. SIX supports legislators who are working to strengthen our democracy, defend civil rights and liberties, protect the environment, fight for working families, and advance reproductive freedom. Next slide, please. At the end of last year, SIX had engaged with over 1,800 state legislators of the over 7,000 state legislators in the 50 states, and that represents 25% of state legislators. In addition to working generally with lawmakers, for state legislators who are committed to reproductive freedom, we welcome them to join our Reproductive Freedom Leadership Council, or the RFLC. And the RFLC is a cross-state network of over 600 justice-focused state legislators who support reproductive health rights and justice, and are equipped to fight back against legislation that limits our freedoms and advance proactive measures. SIX is a trusted resource providing year-round guidance, hands-on assistance, tools, and skill building to support state lawmakers as they collaborate with their communities, co-create legislation with their constituents, and connect with organizations. We invest in the long arc of justice to achieve long-term change. And I'll say that many of the lawmakers on this panel today are also RFLC members. Next slide, please. Additionally, SIX serves as a bridge between legislators and our movement partners. And that's actually why I've been asked to be here today to talk about how connecting with SIX can help connect you all to legislators. So SIX's theory of change embraces a collaborative governance model where elected officials, their constituents, and civil society leaders build, shape, and sustain shared power in service of racial, social, and economic justice within our multiracial society. And our programming reflects that. Next slide, please. With a particular focus on the dynamics in each state, SIX provides policy support, communication products, research, trainings, convenings, technical assistance, and strategic advice. Specific examples include we have rapid response rooms, which are policy strategy meetings for state legislators and legislative staff from across the country. And on Mondays at 12 p.m. Eastern Time, during legislative sessions, we host these 1-hour Zoom meetings. And we feature movement organizations as guest speakers, so legislators and legislative staff have the opportunity to learn about needed policies, hear about the challenges of policy implementation, and the impact of the policy decisions. Another example is SIX is part of the Arizona Proactive Reproductive Justice Alliance, and that is comprised of movement organizations and individuals. And the Alliance drafted a package of bills to repeal abortion bans and restrictions in Arizona. And then RFLC legislators sponsored SB 1553, and the Alliance hosted reproductive justice legislator trainings and a press conference so that legislators have messaging guidance and are getting comfortable responding to opposition. Another example is that this month, SIX filed a submission to the United Nations Universal Periodic Review. And it was to outline the US's human rights violations in sexual, reproductive, and maternal health. And denounce the federal government for failing to uphold the commitments it made during the previous UPR review. And over 200 state lawmakers from 45 states signed on, and if any of those signers are here in the audience, we really appreciate that. SIX also hosts webinars, and this is another place where we feature movement partners in a series we called Conversations with an Expert. And we have a monthly newsletter, and that's for legislators and partners, and we share publications from partners. And then SIX also has a national conference every 2 years. Next slide, please. SIX also connects legislators to research and clinical experts. And in this picture, you see a Southeast convening, which is at RISE, the Center for Reproductive Health Research in the Southeast at Emory University. SIX also sponsors global delegations. And in January, we had a Latin American delegation with lawmakers from Argentina, Chile, and Mexico who traveled to Atlanta and Washington, D.C. to meet U.S. legislators and share insights and strategies in the global fight for reproductive justice. Latin American lawmakers toured the Georgia Capitol, as well as met with our partners at the Atlanta Birth Center and the Feminist Women's Health Center and the Abortion Fund ARC Southeast. And it was remarkable because one of the Argentinian senators summed up one aspect of her learning in the delegation as, "What's clear to me is that the American dream does not include women." We're also excited that we're going to have a Brazil delegation with some of the legislators on this call as well, who are going to attend in May in Brazil. Next slide, please. So Black Maternal Health Week has been a really exciting time at SIX. And state lawmakers have taken multi-state collective action on Black maternal health. And in collaboration with Black Mamas Matter Alliance and the National Organization of Black Elected Legislative Women, Nobel Women, SIX is supporting nearly 20 state lawmakers to introduce proclamations and resolutions in recognition of Black Maternal Health Week. And in alignment with collaborative governance, legislators were encouraged to collaborate with birth justice advocates in their states. And SIX's Nevada State Director and Assemblyman member Linda Hunt did a proclamation. That's one of the pictures that's up on the screen. And then SIX's Colorado State Director helped with a proclamation and tribute to partner organizations, including Soul to Soul Sisters, Elephant Circle, and Sister to Sister. And then lastly, we created with a graphic designer custom social media graphics with personal commitments to advancing Black maternal health, and worked with SIX's PR team to get the word out there. And we're excited with all the press attention uplifting the importance of policies that address Black maternal health. Next slide, please. So this is 2 examples of resources we provide. We have an online database of videos, messaging guidance, talking points, and research on all the issues we work on. We also provide in-person and online trainings for lawmakers on cutting-edge issues such as the We Count data on the impact of DOBS, self-managed abortion care, and fighting pregnancy criminalization, which is just so important in this moment, as other panelists have discussed, and really just on the rise, and really a goal of the anti-abortion extremists. Okay, next slide, please. So here is the SIX Repro website QR code, and this will take you to the website to learn more. And if you are a legislator, please do consider joining SIX's RFLC. Next slide. Thank you so much. And you can always reach me at sydney@stateinnovation.org if you are interested in connecting with legislators in our network.
Amazing. Thank you, Dr. Jemmett. Thank you for sharing how you connect grassroots organizations to legislators and connect lawmakers to research and clinical experts, and for opportunities for all of these stakeholders who are here today to connect with policymakers. So thank you so much for all the important work that you do at SIX. Finally, for our panelists, we will hear a message from Senator Erica Geis from Michigan.
For being here. Black Mamas Matter Alliance really appreciates your input in the work that you have done to help with sponsoring the bills, and they really want to see what they can do to strategically plan to see something like that come to fruition in Georgia. But we will go ahead and get into the questions.
Thanks, Tamika. And I'm so glad to be able to do this recording for Black Maternal Health Week with Mothering Justice and Black Mamas Matter Alliance. The state of Black maternal health in Michigan could be much better. It has improved marginally over the last few years because of the information that's come out of the work done by the maternal mortality team, the policy changes that have been made, having a collective of doulas working with the Department of Health and Human Services to help improve outcomes. We can do a lot better. And we can do a lot more to improve Black maternal health in our state, to make sure that outcomes continue to trend up for mothers in terms of having healthy pregnancies, having healthy postpartum periods, culturally congruent care that helps our mamas thrive. I became a legislator in 2015, so in the last decade, things have improved. We need to keep doing more and keep doing better. Well, we started this last term, being able to, for example, have licensure of freestanding birth centers. In fact, there's one in my district, so Birth Detroit, which celebrated a grand opening and has been doing, doing the work. We also had the Momnibus. That was introduced last term. That was a collaboration mothering justice between the state of birth justice, between the Council for Reproductive Justice. Here, I love that like everything's rooted in justice, right? And it didn't make it because last term was strange. I'm so excited to report that it's being voted out of the Senate this week, which is so perfect during Black Maternal Health Week. It's a bill package that came from the community, came from, at the time when it was being written, people who were expecting or hoping to be expecting, new mamas who've been around for a while, midwives, doulas. And so it came from saying, this is what does the community need in order to have positive birth outcomes? And that's what created the language. So things that are centered in data, centered in making sure that we're collecting that data and that information is going to be used by policymakers to improve policies. We're tightening protections so that people have the type of care that they need without discrimination. We're making sure that certified nurse midwives and midwives have the licensure and the protections that they need to continue their practice. And these are things that community members want and need in order to feel safe and secure and have positive birth outcomes. And making sure that there's coverage for those services, that there's coverage for doula services. And another thing that was part of that package last term that did pass was making sure that there's a scholarship program for doulas so that the barriers to entry are reduced. The term Momnibus, we did not invent it. Right. And I have to give all the credit to Congresswoman Underwood for starting that lexicon, for, providing a blueprint that she's continuing and her other colleagues in Congress continue to work on. It's necessary at the federal level for, our representatives in Congress to be working on these issues, bringing them to the forefront. But we also know that sometimes it's going to be up to us in the states to make sure that we have aligned or equivalent or matching types of legislation that's going to work for our communities. I am very concerned about how federal cuts will affect access to care in terms of those Medicaid dollars. while the funding comes from the federal government, it's up to the state to manage how those funds are used. But when we're talking about those programs for vulnerable moms and babies and their families, not just babies, but children as well and their families, how does that affect what we do on the state level? I'm hopeful that as we work through our budgets during the appropriations cycle that we're in right now, that we're able to make sure that we're still able to make sure that the people that are on Medicaid or who might find themselves on Medicaid are able to still get quality care. Having a very strong community focus is important. The community mobilized is important. Community wrapping its arms around each other, but also collectively working to help push for policy changes that are positive is going to be necessary. Most of the legislation that actually truly works, most of the policy changes that truly work for the needs of the people are the ones that come from the people. This state of Black mamas, I think, is a reflection of sort of the state of the health of our people collectively. And I think that when we are uplifting our voices, uplifting our needs, it is so powerful and so meaningful. Like, that's why I love the work that Black Mamas Matter Alliance and Mothering Justice do. Like, this work is so real and so necessary. And I love the fact that it really is centered and rooted in joy. I think when we have that sort of propelling us, even when things like look and feel bleak, but when we have that propelling us, it's impactful in ways that are in both tangible and intangible.
Well, thank you.
Sorry, I was trying to get my video to start back up. It won't let me turn my video on. So I wanted to go to it. I wanted to go to the Q&A side real quick. I know that we're kind of tight for time right now, but I had one question in here that I did want to present to everyone because it was to all of the panelists and whoever's still remaining. Like, how can health plans and public health departments assist and work around Black maternal health? And this is to all the panelists.
I'll go first. I think that what was mentioned was the idea of tracking data and how we see that that's under attack. So the ways in which public health departments can continue to keep track of things and publish the information that they're finding so that we can at least have a record of what's going on and continue to point to the things that need to be addressed. That's what
Did anyone else want to?
Yeah, can you just repeat the question? I just want to make sure I'm answering it correctly.
Okay, and it's from Monique Webster. I want to make sure I shout her out. But it says, how can health plans / public health departments assist and work around Black maternal health?
Yeah, absolutely. So I think I want to first echo what Sydney said. I do think that it's important for the data to be there, and for the data to not just be there, but be accessible to the people who can use that data to make informed decisions. I also think that it's important for us to educate. I was having a conversation today about, when I was giving birth, I felt confident when something was wrong. I felt confident to speak up and say, "Hey, something is wrong." A lot of people do not feel that way because they don't feel like they have enough knowledge to question the people in the room who they feel are just much more knowledgeable than them. So I think education goes a long way. The same way we educate people on, this is how you know if you're having a stroke. This is how you know if you're having a heart attack. This is how you know if you have the chicken pox. Like, public health is about not just preventing the spread of disease or things like that. It's also about educating the public on what to look for. So telling people, this is how you know if you are having symptoms of preeclampsia. This is how you know. This is when you should call the doctor. If you are in pain, it is okay to say, "I am in pain," and don't let someone tell you you're not in pain. These are the kind of things that I think that public health officials could do to make sure. So the research is important, but the education, I think, is also paramount.
I'd like to add to that if no one else wants to. I like to add also like comprehensive training of the actual medical staff. Like, we need to acknowledge that medical racism is real. And I just wanted to make sure I threw that out there because, like, subconscious bias exists, and when somebody is in charge of your care, those bias can impact you. It impacted me in my birth. So I just wanted to make sure I added that on, and thank you guys so much. Tony?
Agreed. I echo all of the sentiments, and I thank all of our panelists for all of your contributions for today. If we can go to the slides, I'll kind of walk us through our conclusion for today. So here's our call to action, and there are a lot of opportunities for us to continue engagement. One thing that I see in the chat is a lot of people connecting and getting ready to, work together to move work forward. So we love it. We see that people are already connecting to amplify the work and to continue to make progress. Additional ways to keep engaged include staying informed, advocating for change, getting involved, and preparing for policy shifts. You can visit our Black Maternal Health website to learn more about BMMA and Alliance Partners Black Maternal Health Week 25 events. And as we wrap up Black Maternal Health Week, you should also get excited for upcoming events, including Black Maternal Health Culture Fest and the Black Maternal Health Conference of 2026, which is one of my all-time favorite conferences and events. So finally, this is the conclusion of Black Maternal Health Week 2025 policy webinar. Thank you again to our Changemaker sponsors, California Healthcare Foundation and Merck for Mothers. And thank you to all of our Alliance partners nationally and globally for another successful Black Maternal Health Week campaign. We want to thank each of our panelists, presenters, and attendees for coming today. You can sign up for our newsletter at blackmamasmatter.org/connect to receive timely notification of upcoming initiatives to be involved in Black maternal health equity work year-round. So thank you again to everyone, and take care. Thanks so much.